welcome to Something to Talk About. For the next hour, we are going to be learning all about vision because September is Child's Eye Health and Safety Month, which we will find out momentarily. But, as usual, when we first begin, I would like to welcome you. If you have a question for our wonderful guest, whom you will meet momentarily, you can give us a call this evening at 781-270-9199. You can always email me anytime, day or night, by emailing talk@bcattv.org. If you have a question for a guest, I can always forward it. Or if you have a suggestion for a future topic, I love to get new ideas. We have a wonderful crew for this evening. Chris Flaherty, staff member extraordinaire, making sure that we don't set the place on fire, which we haven't done yet. Thank you, Chris. Colleen Moore, Jolie Atwood, and Liz Gillespie have given up their Wednesday evening once again to come and hang out at BCAT, and I do really appreciate their dedication to the show. So, last but not least, I want to thank my husband Paul for staying home for Daddy Date Night. Hopefully, back to school, have the kids back to a routine and in bed at a reasonable hour. So I think everything, all the logistics aside, I would like to introduce my wonderful guest for this evening, Catherine Kennedy, OD. So you are a doctor of optometry. Optometry.
Got it.
All right.
You know,
Developmental and behavioral optometrist.
Yes.
That is really cool.
it is.
It is cool. It's not like your standard, Anyway, before we get into children's vision care and what September means, can you tell me a little bit about yourself, where you grew up, how you came to the Burlington area, and what made you decide to become an optometrist?
Well, I kind of lived all over the place.
Military or not?
No,
Or-
that's
okay.
exactly, that's the first thing anybody says, but my father taught, and then he did some more graduate work, and then he was a college professor, so I lived in several different places: Hawaii, Connecticut, Texas, Virginia.
That was kind of nice.
Yeah, well, I was pretty little then.
Well,
And then we went to, and then I went to college in Wisconsin.
oh, wow.
So that was good. And it was there, actually, I was a biopsych major, and that was kind of the precursor to being a neuroscience major.
Neuroscience, wow.
Neuroscience, that's kind of
I took microbiology for non-science majors, and that was
For
a huge
non-science
mistake.
majors.
So,
No, that was fun.
Neuroscience?
Neuroscience, that's a really popular major nowadays.
Oh, okay.
But it's like, for me, it was the biology of behavior, or the
So like the whole
when I
nature
took-
versus nurture type thing?
A little bit of
or-
that.
Okay.
So I would take, physiology, anatomy, genetics, but I took psych courses like perception and physiological psych, which is all about brains. So brain
okay.
anatomy was really cool. I
Wow.
liked that a lot. But in the course of that, I took courses in perception,
Okay.
and there were lots of really interesting studies about vision,
Okay.
and some about hearing as well.
Oh,
But the vision
okay.
experiments that, and
Is that
some
like
of them were
those
out of-
optical illusion type things?
Well, yeah, we learned
kind
about
of?
some of
Okay.
that. Yeah, we learned about some of that. But there were also studies, and some of them were done at Brandeis. There
Which
was
is very local.
Which is local, and I was out in Wisconsin learning about it. But Brandeis and at MIT, people that did things by putting prisms on and making people see things differently,
Okay.
and how the brain adapted. They actually did an experiment where they put prisms on that made things look upside down.
Wow.
And then they had, around the campus at Brandeis, they had some students that had to try and walk around with these upside down
that's
glasses
weird.
on.
Hopefully,
really weird. And
I
then,
know people that get motion sick. Would that?
probably.
They're probably not good case studies for
No,
this.
probably not. And then these others that got wheeled around, and what they found was
Still wearing the glasses?
Still wearing glasses. So the people that walked around adapted to seeing things upside down. Their brain said, oh, this is up, this is down, okay, I can do this. Whereas the people that got wheeled around, they never really adapted to it. Visually, they were getting the same information, but their bodies were doing different things. And this is kind of where the behavioral optometry comes in, is we recognize that you do things. Vision is active, and movement is part of learning how to see. Anyway, so I thought
Okay.
this really
Yeah, that is pretty
I
weird.
thought this
I've
was
never really
cool.
thought about it before.
I thought this was really neat. And so when it came time, end of junior year, and you're going to your counselor, and they're saying, well, what do you want to do with the rest of your life? We've got to, help you get on to the next step.
Okay.
And I said, well, I think vision's really interested. I don't want to do research. I don't want to teach. I kind of like working with people. My advisor says, go talk to this optometrist. I think this guy does some really neat things.
Okay.
So I go down the street, I talk to this optometrist, and he tells me the story about the Eskimos in Alaska. It just so happened
Okay.
that before there was compulsory, and here's where we get the nature-nurture thing, before there was compulsory education,
Okay.
and before there were electric lights in the villages, in the, out on the ice somewhere
Middle
in
of
Alaska.
nowhere, Alaska.
Right.
Okay.
All the adults, everybody was farsighted. There was no incidence of nearsighted in that population whatsoever. Education comes in, they get electric lights, the kids are studying, they're doing all this stuff. The kids of these people that had never had nearsightedness anywhere,
All of a sudden,
they were developing nearsightedness.
really?
Really? Yeah. So that just kind of shows how you use your eyes
Yeah.
affects the way you see things.
I'm
Anyway,
not
so
sure I would have
thought that
predicted
was-
that, but
Well, I thought that
That's
was
pretty
really
cool.
I thought it was really cool. And here's this profession where I can work with
That's all
people.
about that.
All this neat stuff I was learning about in school, I can use this
wow,
scientific
you actually
knowledge.
used your degree.
Exactly. I can use this scientific knowledge. I can come back. I can learn how to be an optometrist, and then we can kind of apply these kind of principles.
Now, is
to-
behavioral optometry kind of a new subject?
Not really. There have been probably starting in the 20s.
Really?
I'm talking
Okay.
1920 something.
Okay.
There was a man, Dr. Skeffington, who was kind of out in the Midwest, and he was making a lot of observations about how people use their vision and how people's glasses would change over time.
Okay.
And he talked to some scientists in, I think it was Renshaw, actually.
Okay.
There's, physiology, people
Okay.
that were in psych and, perception.
Okay.
And he did a lot of kind of, talking to other disciplines and saying, how does this all work?
Wow.
And so he started coming up with a lot of ideas
Cool.
and found like-minded, people, and it kind of all grew up. And he went around and lectured, and
Wow.
so they would have like seminars at the
Because
university.
until I met you, I had no idea that
Yeah.
this whole thing existed.
Yeah, so it ends up being something that has a different type of intellectual inquiry, if you
Yeah.
will. There's
well,
a lot
there
of
is that sense of
yeah,
inquiry and
and the developmental thing, liking to do things with kids
yeah. Okay.
and spending a little bit more time as opposed to just thinking about, oh, I'm just going to measure how
So it's
somebody
more of a
sees.
problem solving.
Yeah, there's a
it's like
different,
a
it's a different kind of a different kind of problem solving,
Yeah.
as opposed to not just how is the light focusing to see clearly, how is the eye structured, are all the pieces in the right place, are they healthy?
Oh,
I mean,
okay.
that's the basic. You got to
Yeah.
have that. We got to
True.
have that. But the eyes are actually a piece of your brain in a sense.
In a sense.
Embryologically, part of the tissue of the eye, the
Okay.
retina, is an outpouching of the brain.
Oh, okay.
So
I
actually-
didn't know that
yeah,
either.
yeah, that's all sorts of stuff. And then there's pieces of skin and other things in there too. But
Yeah.
so the brain and vision. I mean, it's all connected.
Cool.
So it is cool.
Okay.
So I thought that would be really neat. So I became an optometrist.
That is pretty cool. And you decided to specialize.
Yeah, so I knew that, this optometrist has told me about vision therapy, how you
Okay.
can change, you can help people develop their vision so that
Okay.
they are performing better, more easily. And
okay.
so, like I said, here's some place where I can help people
It pulls all of your
pull
interests
all my
together.
interests together.
Because I
So
do
said,
want
I'm
to,
gonna do that.
later on we're going to talk
Yeah.
about how vision is kind of related to everything else,
Yeah.
a lot of behaviors. But I learned that September is Children's Eye Health and Safety Month.
Right.
What exactly does that mean? I mean, they have a month for everything.
They do.
But
There's so many months. There's so many months out there. So Prevent Blindness is an organization that actually started in the really early 1900s.
okay.
Because at that time they noticed that newborns in particular sometimes would get eye infections during the birth process.
Okay. Yep.
There are germs around and stuff. Places aren't sterile. And sometimes that would lead to loss of vision.
Okay.
You know,
Wow.
they were
Okay.
infections, so maybe their corneas were scarred, or, you know, that things would happen. So it was, they really promoted, oh, if there's a baby, let's make sure that their eyes are treated so they don't get any infections.
Right.
So that actually came to pass laws that babies had to have eye drops when they're born.
Wow. Okay.
And so that makes sure that if there's any little germs there, it's okay.
The germs go away.
Germs are taken care of, and so that's kind of where they started. And then, so
Okay.
that was obviously a very important, and so that mission. So they have that mission to try and promote
Okay.
eye safety and prevent blindness. So they you know, so they, you know, you got a month for everything, like I said. So that's theirs. So obviously there's the one of the things for kids nowadays, you know, there's toy safety. I know an optometrist that goes around and checks the toy stores around
okay.
the holiday season. Will look and see, okay, what's out there that you really don't want your kid using?
Yeah, exactly.
Because, you know, this is going to hit them in the eye. So that's this toy.
Kind of
toy
like the
safety
whole
stuff.
Louis Braille story comes to mind.
Okay. But then there's the sports safety too.
Okay.
You know, making safety glasses and being aware.
And that's also like
of
impact
falls.
too. Like concussions are
Oh, that's a
really
whole nother
involved.
thing too. Yeah,
You know, there's a
concussions-
heightened awareness of that.
There's a real heightened awareness because
Okay.
from the concussion is a whole other thing, because that's not much sight damaging from an eyeball perspective, which
Okay.
is kind of what this
Well,
eye
yeah.
safety would be thinking of. But there's the whole fact that the eyes are a piece of your brain, and the concussion is a brain thing.
Okay.
And yeah, so the interesting thing is in concussion, you know,
Well, your brain rattles
your brain
around.
rattles around, and the problem is if this is your spine and this is your brain and it gets shook
Yeah.
up, the part there that's wiggling back there has a lot to do with eye muscle control. So convergent, there's a lot of people with concussions
Okay.
may have convergence problems.
Oh, okay.
And because of, you know, if
Because
that's
your
the way
brain's
it
rattling
was, and
around
the
in your
brain's
head.
rattling around,
Okay.
and that part of the brain is susceptible. Anyway, but last month,
Okay.
August,
Okay.
was the Vision and Learning Month. And that
wasn't on my sheet,
that wasn't
so
on
I
your
couldn't-
sheet,
that-
so
yeah.
there's Vision and Learning. Actually, the Governor Baker did a proclamation. I've got a copy of the proclamation, one of those things, you know. Whereas,
Thank you, Charlie.
Whereas, you know, learning is 80% in through the eyes.
Well,
You know, the
yeah.
visual system is important.
It
So
is.
therefore, we want to make sure that all the students of the Commonwealth
Have
That's
good
right.
eyesight. Okay.
yeah. So you want to have good functioning visual systems for good functioning students.
That works.
Yeah.
So, do we want to talk about vision therapy, or do we want to check out some of the cool stuff that you brought?
Well, I could show you.
I'm just like sitting here going, yeah, I have my list of questions, but this stuff is kind of
cool on the
neat.
table. Well, so some of the things I brought here today is just, some of it's to demonstrate what I might do in an exam.
Okay.
Obviously, I don't have.
So why
my
would
thing,
okay?
so-
So
that's why
was a
some
little
of that
premature.
stuff- so some of that stuff is for
why
that.
what is vision therapy, and why would somebody come to see you professionally
Mm-hmm.
as opposed to a regular optometrist?
Mm-hmm. Well, like we said, since the eyes are a piece of the brain, vision is something that you learn how to do from the time that you're a baby.
Okay.
As a baby,
Never really thought about that.
yeah, kids have
Okay.
to learn how to see.
Okay.
And the interesting thing is that
Things I take for granted.
you do. Yep, everybody does. And just like they have to learn how to move and walk and talk, they learn how to see. And unlike walking, where if you do it incorrectly, you'll probably fall over, or somebody will notice that your foot's tweaking the wrong way, or talking, where you will correct your child for not pronouncing something correctly, you have no clue how anybody else sees, or how your kid is seeing.
And how do you teach that? I mean, you can teach
well,
someone
okay,
a
well,
lot, but I'm getting ahead of myself.
No, but anyway, but because it's something that's learned, that means if it's off track somehow, if something has happened in the learning process, the developmental process, there's a chance to train. And that's in vision. So vision therapy is an opportunity to train a visual system to work the way it's supposed to. When it's off track. And it may be off track because it was never learned properly to begin with, for whatever reason. Or it may be off track because there's been an injury, like a concussion, which has thrown the system out of balance.
Or they didn't get the right eye drops when they were born, or
no, that's a whole disease thing. So, no. So basically, vision therapy is a program of you might say exercises, but it's not exercise this way.
Your exercise, well,
it's
eye
exercise,
muscles.
It's brain exercises.
Now, does also involve eye muscles, because there are a lot of little tiny muscles in there.
Yes, there are lots of tiny muscles. So a lot of vision is actually fine motor. People are used to thinking about fine motor fingers. Speech is a fine motor activity. So if you have, I'll see kids they're in speech therapy, they're in occupational therapy, because their articulation, they don't have everything isn't working right there. They don't have that fine motor control. They don't have the fine motor control. Well, the little muscles in your eye that allow you to focus to see at different distances, that's a fine motor control. And the eye muscles that move from place to place. There's 6 around each eye.
Wow.
And each of those, actually, the latest anatomy studies have decided that probably each of those muscles is probably a set of 4 that are kind of coupled together when they look at it. So it's complicated. It's complicated. So if
I'm also trying to figure out, as you're talking, it's like, well, how do you even know that there's a problem? Because like we mentioned earlier, you can't tell what someone else is seeing or how they're seeing.
Well, that's
that's why we call you.
That's why you get your eyes. That's why you get your kids' eyes checked. So obviously, if you want to go through some kind of testing, what kind of testing things, and the obvious thing is to make sure that they can distinguish details. So distinguishing details is eye charts. And there are lots of different ways to do eye charts, and there are quote eye charts that you can even do with babies.
Really?
Yeah, because babies because if they are visual, patterns are more interesting than plain things. So there's actually what's called a forced choice situation, where you can show some stripes, and you can show plain, and you put these 2 things in front of a baby, and the kid looks here because that stripes are more interesting than the plain one. And
I think we actually participated in a cognitive study at Boston College when my kids were really little, and it was they
had to look.
It was more like number, but maybe it was pattern, because it was 1 dot over here and 4 dots over here, and
but they were using that concept of preferential looking, that you can tell, you look where the baby's eyes are looking and you know what they're seeing. So if you make the stripes smaller and smaller and smaller, at the point that they're kind of going, I don't know which one's which. Then they can't see the stripes anymore, and so you can. So even with little babies, you can do
That's pretty cool.
acuity. But for a school-age child, being able to look at the eye chart on the wall, obviously, or it's on a screen now, but doing the same thing, looking up close. So being able to look at little print up close, and be able to do that just as easily as looking at things far away. Because obviously that's where they're reading. And if they're not focused, and you can have somebody that focuses really well across the room,
but they can't.
And they go to look up close, and they're seeing, they're 20/20, even better than 20/20 in the distance.
So they're farsighted,
exactly.
Alaskan Eskimos.
But up close, maybe it's 20/40, it's not as good. So you look at acuity, and you wouldn't know that without doing a test,
Yeah.
how they're seeing. I want to look at eye movements. And the most obvious way that I would do that, I've got just a little bell that I use because it makes
Bells
noise.
are cool.
Bells are cool. And I
Squirrel.
like to, yeah. And I like to have fun. And if the kid's not looking, so if I have them follow it, I can do, I can shake it. Okay,
How
so
do you get a
that.
kid, though, not to...
Well, see, that's where we talk about behavioral, developmental
okay.
stuff. If a kid's 3 or 4 years old and they're doing that, that's perfectly normal. I'm looking at the behavior. Now, from a mechanical standpoint, yeah, you want to make sure the eyes can go in the different directions.
Okay.
So then you might stop and say, okay, does the eye actually move in all those directions?
Okay.
Are the muscles actually working? And
And do you also figure out, like, distance, like if they can only look up halfway versus like their eyes roll back in their head? I mean, do you judge?
You look. I mean, in terms of if you put the hand on the head and you go, okay, is there what's called a full range of motion?
That's kind of
full range of motion kind of thing, and a regular eye exam will look at that full range of motion because that's making sure that physically the system's intact. But from a developmental standpoint, I want to see what they do with it too.
Okay.
So that's why I go ahead and let them move their head if that's what they want to do, just to watch. And maybe they start to move their head, but then they stop because they realize, I can do this without. So that's
cool. My eyes move.
But that's another, a layer of sophistication. By the time they're in school, I want to see them sitting perfectly still and just watch.
Looking at that.
And see them doing it, back and forth and around in circles and not having any problem with that by the time they're in school.
Now backing up to when you were in school, I'm also thinking, if you're dealing with 3-year-olds and school-age kids, did you have to take like child development courses to figure out what kids are capable of doing, or is that more like on-the-job training?
It's in the manual.
Okay.
Yeah. Part of my training was at Gazelle Institute in Connecticut, in New Haven. Dr. Gazelle, back in the 40s, 50s for sure, was doing a lot of, he was a pediatrician and did a lot of developmental work. He took movies of babies and he worked with an optometrist, Dr. Getman, and they really looked to see what do kids do at different stages. Okay. So it's kind of it's been codified, so to speak.
Okay.
So we want to look at eye movements, and not only can they follow. So I was going to say, if the kid, if a child is in kindergarten or first grade, second grade even, and I'm seeing them, still doing all this stuff like you did at the beginning, if they're in a classroom and they're looking at the teacher, but then they got to look at something else, and then they got to look at something else, and then they got to look at something else, you got a kid that's wiggling around in their chair a lot. And the reason they're wiggling around their chair a lot is they don't have that visual sophistication. Or they could see.
So they might get misdiagnosed for being,
So then, I write in my report that this kid might move around a lot because they haven't learned how to use their eyes independent of their body yet. Okay. So that's something we got to work on. And besides tracking, I'll borrow your pen here, I'll also have them look from point to point. So those are quick eye jumps. They're called saccades or saccades. Okay. And that's the kind of movement that you
I'm waiting for you to start writing.
No.
Linda does this, and
she's passing so far.
She's passing so far. Yay!
Yeah. So those eye movements.
But if I took my glasses off.
Yeah.
You got a pen?
That's another thing. But those types of eye movements are what you use when you're reading in a book.
Okay.
Because words are not moving.
Because you have to jump from word to word.
You have to jump from word to word. Exactly. And that's and in order to jump from one place to the other place, you have to do a lot of different calculations. Like, as mothers, we have eyes in the back of our head, right?
Absolutely.
Yeah. So I try and teach.
I need a haircut, though, because it's hard to see.
It's hard to see. And that's use of peripheral vision. So I'm looking at you, you're looking at me, but in the corner, we still know where there are other things here in the room, right? So when you're reading, if you're looking at one word, you can still see where other words are on the page, so you can make your eyes make a jump to the right place. Someone who hasn't got use of looking at one thing and coordinate that with their peripheral vision, sometimes that doesn't work so well. And they lose their place. And they don't keep their place in what they're doing. So at one test that I do, no, this is in school-aged kids. It's called
backing up a little bit.
Yeah.
Do you just work with kids, or do you also work with adults?
I do this on adults too.
Okay.
Yeah.
Because you would think that if there were vision problems, that adults would have figured it out by the time they're adults.
Different types of problems.
Oh,
I mean,
okay.
So they may have gotten glasses,
Okay.
so they can see clearly, and that's been fine. But they still fall asleep when they're trying to do their reading. They've
That's a vision thing?
That's a vision.
Wow.
That can be
like
a vision
narcolepsy
thing.
is. I don't know.
Reading, it's a classic symptom of a binocular vision problem. If reading puts you to sleep when you're not tired.
Okay.
I mean, if you're sleeping at the end of, you're
Well,
reading,
also depends on the quality of the book that you're reading.
Right. Yeah. That's true.
Okay.
But yeah, if reading puts you to sleep, yeah. So yes, people of all ages. And so I do this with adults. This is only actually normed through 8th grade, but I do it
Similar
on adults too.
tests. Okay.
Right. I do it on adults too. And what it is people have to read down columns of numbers.
Okay.
And I time them.
Without moving heads.
Well, I just have them read them.
Oh,
I mean,
okay.
it's on a thing in front of them. They're reading. It's on a table in front of them. They just read it like they were reading.
I wasn't sure if it was like an eye chart
No,
that was like
it's just right here, 375,982.
Okay.
And they read it off. They do that for a couple of pages, and that gets me kind of a baseline. That just tells me how fast they can talk, essentially.
Okay.
It's called a rapid automatic naming speed.
Okay.
But then, the exact same numbers that they just finished reading are displayed sideways across the page unevenly.
Oh.
That's what everybody says when they see this.
Yeah.
Yeah, everybody kind of looks at that and kind of groans.
Well, yeah, because when you get halfway down the page, it's kind of hard to figure out what's straight across, and you start doing the whole matrix thing.
This is this whole thing. It's uneven, just like words are different sizes, so you're making uneven jumps.
Okay.
It's true if they were words, it'd be more continuous, but this is, can you look at one thing, figure out what the next thing is, and how quickly can you do that?
Okay. Can I go on another tangent?
Sure.
I'm sorry, but this is all like really cool, and I'm like, my brain is about to explode. Now, when we're talking about this test,
right,
we are assuming the person reads from left to right.
That's true.
Now, have you noticed, or have there been studies done about the different cultures that do right to left, or and isn't it like, is it Chinese that goes up and?
Yeah,
I thought something went up and down.
Right. I think by now an awful lot of I don't know what they use in China.
Okay.
I don't know if they use this one in China or not. They've normed it for other languages because I think somebody did a Spanish version of it. They normed it for Spanish because you can imagine that the amount of time just it takes a mouth to form the names of the numbers in one language might be different than it is in another language. So they did do that.
Okay.
And actually, I think if I had somebody, I could email people that I know in Israel to find out, but if they do it backwards or not.
Yeah. I don't know. I'm just wondering if those.
But I think optometrists.
Because I was thinking more of like the up and down versus side to side because.
Right. Well, this is an interesting thing actually to bring up.
Okay.
Because this, let's see, I don't know if the date is actually on it here. Copyright doesn't have a date. It's probably in the manual has the date. Because this test now has certainly been around for 30 years.
Okay.
And my supposition, and I think the supposition of the doctors that made the test and did all the norming on it was, as you get to be a good reader, And it shows that the better a reader you are, the more experience you've had with reading, the better you get at doing this tracking thing.
Okay.
Right? So if I do this on a first grader, it takes them probably twice as long to do this page as it is the other two combined.
Okay.
Whereas by the time you're high school or above, I'd like to see you doing almost as fast on this one as the other two.
You would like to see.
I would like to see that. I would like to see that. But then I've realized in the past few years that people are getting so much practice scrolling. They're doing an awful lot of tracking this way.
Oh, okay.
So maybe they aren't biased as much.
Okay.
That they're really good doing it this way too. So I don't know if we have to go back and renorm it, but I'm still doing this the way,
Yeah, that's a whole other topic for another conversation about, smartphones.
So this is still a in terms of tracking, so they're norms. So if I see that somebody is making more errors, like they're skipping every other line, and they're in 5th grade, they shouldn't be doing that.
Okay.
So that there's a tracking
There's
problem.
a pattern
There's something
here.
where they don't know how
Okay.
to get from point A to point B as accurately as they can. So that has to do with how, some things, looking at eye movements.
Okay.
So that's something that obviously you can see how that relates to academics and development, things like that. Another thing we talked about being able to look at things up close and far away.
Okay.
So we talked, there was a little focusing muscle.
Mm-hmm.
That muscle sometimes really isn't fully developed and really working. It maybe sometimes not till their kids are 8 years old.
Wow. Okay.
And children nowadays are expected to do an awful lot.
I
at a
noticed that
very
as soon as my
early
kids were like in
age.
kindergarten, they're like writing journals.
Yeah, well, hopefully it's
When
good,
I was in kindergarten, I was like A, B, and now
when
it's.
When I was in kindergarten, I knew how to make my name, and the teacher would not let me put my name on my paper because it was developmentally inappropriate at that time.
Wow.
I was not supposed to be doing that yet. I was supposed to be playing with other toys and not writing my name. My mother nearly had a fit.
Yeah.
But because that focusing muscle is still developing.
Okay.
And so we definitely want to look and see how easy it is for someone to focus on things.
Okay.
And that's where my retinoscope comes in. And so this
Yeah,
is...
because how do you tell if somebody's focused or not focused?
So this is something you can use with babies, you can use with adults, you can use with kids. So when the light shines into somebody's eye, and I look through my little peephole here, I can see how it reflects out of the eye. And I'm using do this like at a distance, like that, say at a reading kind of distance. Close distance. And depending on how the light comes back out of the eye, I can tell if the person's in focus or not. And
how do you tell that?
Okay.
What does it look like?
Well, that's good. It could look a lot of different ways.
Okay.
If somebody is super out of focus, I hardly see any light bouncing back at all.
Really? Okay.
Yeah, it's like the light gets lost in there or something. I don't know.
There are so many jumps.
Yeah, really. It's like,
Is it because the light gets diffused or something?
Dispersed. It's just not, it doesn't go in.
Lights
and
are
come
on,
back
but no
out.
one's home.
Yeah, exactly. So sometimes you think that. You go, what, is anybody in there?
But if like they're really in focus, can you see like all the little blood vessels and stuff?
That's another light.
Oh,
That's
okay.
this one. Okay, so now I'm just getting a reflection off the nerve light. The retina is a layer of nerves.
Okay.
So I'm getting a reflection off of the nerve layer.
Okay.
And the better that's functioning, the brighter the light is that comes back. So I can see a nice white light coming back.
Okay.
And that person is probably
In focus.
nicely in focus. Like I say, see that dull thing? I feel like the light's getting lost.
Now,
So there's lots of different lenses. So if I put a lens in front of the eye and do it again, now are they in focus? Maybe I need to try a different one. And with the phoropter, that machine that you associate with it.
The big
the big one, right. Yeah. So you kind of click through a lot of them until you find, where are they in focus? Oh, there it is.
There it is. Okay, now with that, Is that just for testing nearsightedness, or can it do near and farsightedness?
It's focus.
Just
Where is the
focus.
focus? So the focus, I could see.
Okay, like a focal point type
right,
focus.
focal
Okay.
point kind of type of focus.
Okay.
Exactly. So if somebody is really farsighted, I can see, I got to put some of these plus lenses in front.
Okay.
If somebody's nearsighted, it looks a little different, so I put the other
Okay.
lenses in. That's if they're looking at something far away.
Okay,
I can
so
tell.
I'm already focused
So
on,
if they're
I'm not
looking
focused
far
on the
away-
light.
Well, it depends what test I'm doing.
Oh,
I've got two
okay.
different tests. So if I have them look at things far away, I can see if they're nearsighted or farsighted.
Okay.
But I can also have them look at something close.
Okay.
And this is important for kids because we're talking about kids. So say I have them look at something close, like
at
the
the
little
bell.
bell, right?
Look at the
so
bell.
if I hold a little bell and I watch to see if they stay in focus while I bring
Okay.
the bell closer.
Yeah, but I feel like I'm
Like
going
so-
cross-eyed as you
Oh
do
yeah,
that.
you're doing. Yeah, of course you are. You're supposed to do that because whenever you look at things closer, you're supposed to converge and focus. So I can see what lens makes it so the person is best in focus for looking at things up close,
Okay.
as well as what lens is best for seeing things far away.
Okay.
And those could be two completely different lenses. Or there
Okay.
could be nothing indicated there, but something indicated here.
Got it.
And especially with younger kids who I said may not be, have that focus perfectly developed.
Okay. Like the prior to 8 years old type
Right.
thing. Okay.
Yep. So sometimes I'm putting very low powered lenses on them, kind of as a
Okay.
protection or a booster.
Okay.
Training wheels, little training wheels, so that they don't get overstrained and they're able to keep on doing what they have to do to
Okay.
deal with the
To like
demands.
retrain the eye and say,
Well,
okay, you need to do.
Okay, it's not
well,
retraining.
that's different.
Yeah, it's not retraining. It's
just
help guiding them in their development.
Training
So-
in the first place.
Yeah.
Retraining comes up another time.
Yeah.
Okay.
Although it was really kind of interesting that I have seen some kids, I see them when they're 6 years old, and their intellects were such that they were really interested in reading, and they taught themselves to read when they were 4. Okay? So
Okay.
sometimes I've seen a couple of these where their brains are just so, they've got the drive that they want to do it.
Okay.
Their eyes were not necessarily ready for it. And then I kind of see some really funky, like
Okay.
astigmatism or other things where
okay.
their eyes are developing a little bit asymmetrically. Astigmatism is kind of an asymmetrical focus pattern.
Okay.
So I think
Now-
it's kind of interesting that I've seen that show up.
Remedial
Yeah.
astigmatism, is that the lens itself is a weird thing, or
a
the eyeball is?
It's a combination. It's a combination.
okay.
A lot of astigmatism can have to do with the front surface of the eye.
Okay.
What does the major original part of the focusing as light comes in
Okay.
is that curvature of the front of the eye. So
Okay.
sometimes you can see it's steeper in one direction than the other direction, which
Okay.
means that, and if somebody's a really squinty person,
Mm-hmm.
so you see people with thicker eyelids, heavier eyelids,
Oh,
have a little bit more pressure on their corneas,
never really thought about that.
and they tend to have more astigmatism than
Wow.
people that don't have as heavy eyelids. So that's kind of interesting.
Eyelid reduction.
Well, that's another idea.
Yeah, that's it.
See, you keep getting all sorts
Little-
of ideas for new shows.
I know.
New shows. So that was our digression. Oh, the
Yeah.
astigmatism.
See, that's why we have
focusing.
the cheat
Yeah,
sheet.
Yeah. So that was.
I need
had
to
talk
focus my
about
brain on the topics for this
focusing
evening.
things. Now the other, so we want to make sure that the eyes are pointing in the right place.
Okay.
We want to make sure they're seeing clearly. And since we have two of them, we want to make sure that they're both looking at the same place at the same time.
Got it.
Because if that ain't happening, we've got a
Then
lot
we
of
have another
confusion.
issue.
A
Yeah.
lot of confusion. And the thing is, you can have, and you were talking about going cross-eyed, convergence is something you're supposed to be able to do.
Okay.
The closer something gets to you,
Yeah.
the more you should be able to turn your eyes in and focus so that you've
Okay.
got your attention on that spot.
Okay.
Okay? But it's supposed to be the right place for the right distance.
Okay.
Some people have a great deal of difficulty with that. And if you're looking at like my finger, and
Okay.
it gets close. This is a 3D target, right? It has
Yeah,
front,
okay.
back, it's in space.
And
You
your
could
eyes are
probably
like
tell.
stereo.
Oh, stereo. So I think, this is pretty easy to know where it is. So
Okay.
maybe I can do that. When you look at a piece of paper,
Yeah.
there's nothing 3D that, by definition, right? That's a two-dimensional
Yeah.
object.
Okay.
And because it's two-dimensional, sometimes an inefficient visual system isn't quite sure where it's supposed to be looking. And
Is
the
that why
same thing with
sometimes you have
screens.
those numbers and the doctor asks if there's a number popping out?
Yeah, that's the stereo test. Right, that's the. In
Because
order
I
to have
remember it's like,
stereo,
look at these numbers and see which one
one
is.
pops out.
Yeah.
Right. I can give you a pop-outy thing in a second.
Okay.
But if you're looking at a page, and if you kind of pretend that my hand is a word with five letters in it, if you're looking at a page and the eyes start not quite getting together, but just so sometimes you can have
So
kind
it
of
makes
this
it like blurry?
movie. Some people might say it gets a little blurry. It's not really doubling, but it might be blurry. It might look like it's shifting.
Oh.
Now,
wow.
if you really, you could, if your eyes are really go off,
Yeah.
you might see
But
double.
sometimes it's
that's-
just subtle
kind
enough
of
to, like, give
little
you a
shift,
headache
like,
or something.
it's an
Okay.
effort. So that's why I kind of say, do things move? Do they shift a little bit when you look at them?
Okay.
And that's a sign that the eyes are
And is that
having
generally
trouble.
up close? Because that probably
Yeah, that's right.
wouldn't-
That's
okay.
usually think about that as
Okay.
being it. Now there are people that also have trouble with eye coordination in the distance.
Okay.
Actually, okay. Side
Tangent.
tangent.
Love tangents.
Tangent. Older women and their cell phones. I'm an older woman.
Okay.
But someone who's nearsighted, okay, and wants to look at their cell phone, and they know if they take the glasses off, they can see their cell phone just fine up here,
Yeah.
okay? Now the problem is they can see it fine up here, but they also have to converge their eyes. Their eyes
Okay.
are in focus for this distance without their glasses, because that's how nearsighted they are,
Okay.
but they have to still converge to look that close, right?
Okay.
But they don't have to focus. We've got these two things. We've got focusing and convergence. We want them
Okay.
to be doing the same thing.
They need
So
to.
here,
They need to work with each other.
They need to work with
Okay.
each other. Here they're at not having to focus, but they are having to converge. So that's a lot of work. But gee, it's a lot easier. So they're looking at their cell phone. They're really interested in their cell phone. They're doing it. They're doing it. They're doing it. Then they put their glasses on and look at something far away. Now the glasses make it so they don't have to focus to see far away, just like they didn't have to focus to see up close.
Okay.
But now they have to diverge their eye. They have to not converge
yeah.
anymore. And that convergence focusing relationship has just been thrown for a loop here. They go to look and try and drive, and they're starting to see double.
Oh,
I
lovely.
had 2 ladies in a row come in
Wow.
in a couple of weeks like that. I'm going, stop
Okay,
doing that.
first of all, stop looking at your cell
Stop
phone
looking
when you're
at your
driving.
cell phone. Well, it's not when they're driving. No, but they stop looking at their cell phone. They get in the car to go drive, and they.
Oh,
yeah, no,
okay.
no.
All right. I thought it was
wasn't in
like
the
stopped
car.
at a stoplight.
No, it wasn't. I don't think it was in the car.
Let's hope not.
I hope not. But anyway, so that convergence and you want the convergence focusing to be working
Okay.
at the same time.
Because
too.
also, the binocular vision also is depth perception too.
Right.
So if you take,
Right.
it probably doesn't matter if you're reading because, like we talked about, it's two-dimensional. But if
Right.
you're driving or something, you
That's
need
me, yeah.
the depth perception to figure out
Yeah,
how
yeah.
close the car. Okay.
And from a reading standpoint, reading with one eye as opposed to reading with having 2 eyes working
Okay.
well is more of
Okay.
a strain. Your brain actually gets the information faster if both eyes are sending the same message. There's a little more brain science stuff.
Okay.
They put little electrodes back on the brain and flash things in front of one eye. Oh, okay, it took that many milliseconds. Flash and say, oh, it took that many
Wow.
milliseconds. Flash both at the same time. Oh, that was faster.
Wow.
Yeah, so if you really want to
And it is like millisecond
it is,
time.
yeah.
So
But it's interesting that
technically
it's
it's
faster.
faster.
It's
Wow.
faster. You get the information
Who
faster.
knew?
I know. It's cool stuff. So since we're talking,
Okay.
talking about, we'll go ahead and let you do the 3D
Okay.
stuff.
Good.
With
I love
your
3D
glasses.
stuff. Okay.
What?
I love 3D stuff.
Okay. So this is
Polarized lenses.
polarized lenses, and the reason they're polarized is because, I'll show you, there's two targets here.
Okay.
So if you wink one eye, you'll notice you can see one with that eye.
I can't see the bottom one.
And
right
change eyes.
It switches.
Isn't that great?
That is pretty cool.
So that's cool. But if I
think something on my dashboard is like that because, like, if I turn my head
there's a
sideways,
filter, with the
something disappears.
Right, sunglasses are polarized
Yeah.
for glare coming off of surfaces.
Well, they're the same. These are opposites.
Right, these are off by 90 degrees. So
and the Museum of Science has this cool thing with the polarized
Right,
thing
where
that
they turn.
turns and you see different things.
Okay. Filters are like that. Okay. So if I can set
This looks really wild. It's like it is three-dimensional.
And I put the little tape there so you'd have a reference.
Yeah.
So
it like pops out.
So does it look like the tape's in front or the rings in front?
Tape is definitely in the back.
And the rings are out
And the rings are like
kind of sticking out at you.
Yeah.
But if you close one eye, it's not going to look like that.
You're right.
Right? Neither eye can do that.
Oh, but the tape's jumping back and forth.
Right? Oh, you're making great faces. I can make the depth go the other way, too.
Oh, that's wild. How'd you do that? Just flip them around?
Well, I shifted which one was right and which one was left. Because if you're, in order to see it look like it's popping out, I have to make it so your eyes are pointing up here somewhere.
Okay. Yeah.
Right? Because does it look like you can stick your finger through it? Yeah.
Cool.
So that's cool. Whereas if I make your eyes point back here to see it,
that is
that
wild.
looks like it goes back.
That is cool.
That's cool stuff. And what's really fun is that even people that have a slightly
Can I take these off? Okay.
Sorry. Even people that have a slightly turned eye and they've been told, oh, you don't have any depth perception. Well, remember, there's that point of the eye that looks straight ahead, but there's side vision too.
Yeah.
Right? We talked about seeing things. And the side vision for the two eyes often have some sort of cooperation going on, even if that little point straight ahead doesn't. So it might be like 20/60 in one eye and 20/20 in the other eye, and have a lazy eye with a little turned eye or something. But a lot of times I can put this in front of somebody, especially if is
that what you were doing?
Tape. I will put this in front of them kind of close so it's really in their peripheral vision, and they'll be able to see that there's depths there and feel and realize that they can use two eyes at the same time. And that's kind of a starting point for doing some other training and work with them to kind of massage that a little bit.
So is that how you were flipping?
Yeah, so that's how, right. So if I
now I can see both rings, where before I could only see one ring.
So if I have it set one way, it looks like it's going back. If I make it go the other way, because this is the one the right eye's seeing, and if I switch the right eyes back here, anyway.
Got it. Okay.
Got it. A little bit of.
I like to see how the magic works.
That's how the magic works. Oh, I did get accused of being a magician by a little girl on Tuesday. It was great.
You're a magician. Wow.
Talking about being able to see things up close, right?
Yeah.
First grader, I asked her to look at the eye chart. She reads really tiny ones. She did pretty well. I asked her to do the ones up close. No, she couldn't see the tiny ones. She couldn't see the tiny ones. I'm looking at her. She's definitely farsighted. I put some lenses on her, and we do some stuff, and I go back and show her the letters that she said she couldn't see before, and she reads them. She goes, "That's magic. You're magic."
You're magic. Wow. You're a miracle worker. How cool is that?
She thought that was really great because I could do magic.
Wow.
So yeah.
Yeah, you probably don't hear that too much when working with adults.
No.
Well,
so that's part of the fun of the kids. That's for sure. So we got to know where things are, being focused, have both eyes working at the same time, right? And we're talking about fine motor.
Yeah.
So sometimes I'll do stuff with paper and pencil.
Okay.
And visual spatial stuff. How can you, how do you approach the page? How can you put things on a page? Can you because that's a visual organization task.
Okay.
So I've got
kind of like kindergartners when you tell them to cut a circle, they have to go right in the middle of the paper. You got a big sheet of paper and then put a little circle.
Oh yeah, they always. Oh yeah, That is developmentally. That's what. If I ask them, if I put a plain piece of paper and I say draw, the circle goes in the middle.
Yeah.
And then if I show them other shapes, they'll go all the way around the edge. Whereas a kid that's been in school for a while will start organizing them in a different way because they learn how to get organized.
Little kids writing their names. All the letters are there. They're just in
all in
random order.
Yes, because they got to come figure out some order to it. So part of I do want to look and see how the eyes work with the hand.
Okay.
And so this is just a fun sheet, which nobody else probably on the air. But there's just lots of stuff on here.
Yeah.
And they have to find the O's. So here's this random display of all sorts of things. And how many O's can you touch with your pencil in making a line?
Okay.
Kind of like doing a dot to dot. How many can you find?
Okay, because I'm like, that would be
How many
confusing if you
O's?
couldn't write because
No,
I'd start
you're not
counting
writing.
the same.
How many O's can you touch with your line in 1 minute?
Okay.
So it's like a dot to dot. You're not trying to draw a picture. You're just trying to find as many O's as you can.
Okay.
So this is really interesting because not only just what do they do with this.
You
but
start in the middle.
Yeah, no. I had an adult start in the middle the other day. And then we call them creative.
Mm-hmm.
But if it's on a table in front of them, are they down doing it like this?
Okay.
Are they back doing it like this? Are they doing it like this? So I get to see how they relate to the page, which is important. That's where I end up talking about pencil grip, not from the standpoint of how you use your fingers,
Okay.
which we'll leave to the OT. But if somebody is holding their pencil too close to the tip and they start to write, their head's going to go down there because they can't see what they're doing because the hand's in the way, right?
Yeah.
So for the sake of the eyes, I say, let's make it back up enough so you can see what you're writing. That way your head, you want your eyes to be even looking at the page. You don't want one eye up and one eye
You want to be able
down.
to see the page.
Because
Kind of like going to the movie theater, sitting in the front row, but we're on the edge.
Exactly.
Everybody on this side of the screen is really big, and everybody at that side of the screen is really tiny.
Okay, you want to know about another study?
Yeah, okay.
This is, again, way back when all the classrooms were, all the desks were in straight lines,
Yeah.
okay, and the chalkboard was there.
You only saw the
and there
kid's
was the
head
light,
in front of you.
The kid's head in front of you, and the light was always on the side, right,
Yep.
from the windows. The window was coming in, and the light was there. They took pictures of kids in classrooms, and depending on where they sat in the classroom, relative to the light of the window, the postures would get skewed. And
Wild.
then they looked and found that
There's a correlation.
There were skews in the way the kids' eyes were focusing. Too.
Wow.
This is a really, really old stuff, but really interesting.
It just blows my mind that people can think of studying this. It's like, let's take a look at,
Right.
desks
Well,
and stuff.
Right. Well, that was the whole thing when they started making sure that desks were sized properly. They really make a really big deal about
Ergonomics.
ergonomics for kids' desks was a really big deal.
Wow.
Way back when, making sure you had the right. They had adjustable desks. Make sure. I have no idea what they're doing with kids now, but that's it.
Some of them sit on the big bouncy balls.
Oh, I like that. I like that.
The yoga balls.
Oh, yeah.
Or they have a
That's
giant rubber
great.
band between so they can do this. And now some
Great.
schools are even having like standing desks.
Yeah.
But I don't know if that's a
That's
visual
good.
thing or it's like a behavioral thing or
Well,
what
I
you're probably
think
going to tell
that's
me
a
is both.
Well, no, it's just the whole motor thing.
Yeah.
That kids can't be confined. And depending on the child, some children need, from the sensory
move.
standpoint. Again, that's kind of a whole OT.
That's a
The
whole
OT.
other
You can get
thing.
a OT in here and find out about
I
that.
know. Okay, what's this thing? Because we are almost out of time. I want to
You're
know what that
kidding.
thing. I'm serious. We're going to have a sequel.
All right.
So what's
so
the
this
jump
is-
rope thing?
The jump. Well,
it's not really a jump
It's called
rope.
the rock string, and it's
Because it's a string
visions
with
that we talked
rocks.
Brock.
Brock.
Mr. Brock, Dr.
Oh,
Brock, Fred
okay.
Brock from Long Island, long time ago. This is a new improved version of it. You hold the
Okay.
handle up to your nose,
My nose.
okay? And you look at the bead that's at the end there.
Okay.
You see that?
Yeah.
All right, when you're looking at the bead, what do you see?
I see 2 reds
Good.
that are close together,
Uh-huh.
and then 2 blues that are a little further.
Excellent. And what about the string?
Well, oh yeah, there are 2 strings, but starting at the red. Wait, no, hold
Look out
on.
here.
I'm looking down there.
Look
Yeah,
out here.
there's 2 strings.
2 strings, and they come to this one yellow bead.
They do.
Now look at the blue bead.
Ooh, well,
What's different?
opposite. Okay,
Okay, it's got a
Whoa.
strain for you. But this is a
But yeah, the blue goes like that.
right. So this is just a really classic.
Now, just out of curiosity, was there
Right.
less space between the red and the blue?
Then yes. Is that what you
Okay.
wanted to know?
Yeah, because the red and the blue seemed really close. Well, they
Right.
seem to be about this far.
Yeah,
but,
well, that's whole perspective thing.
Okay.
Yeah. So this is a really classic vision therapy technique.
Okay.
Which the strings, you've got, each eye has a different view. There was only one string,
Well,
but
yeah.
you saw 2 because each eye has a different view of the world. And where those
Okay.
2 views converge, that's where you saw the strings come together. So for someone that has a lot of difficulty knowing how to converge their eyes properly, this gives them feedback where their eyes are pointing, because where they see the strings pointing, that's where their eyes are converging. So that's a
Okay.
really great thing there.
So,
Yeah.
we are almost out of time. We got
Okay.
like a minute and a half
Minute and a
left.
half, okay.
But if somebody suspects,
Mm-hmm.
why would somebody need to come and see you? If they have vision problems that their optometrist can't solve, or
Yeah, I would say a lot of people come if there's 20/20, if you've had an eye exam, 20/20 eye set, your eyes are healthy, but you still don't feel things are right. Somebody's losing their place. They get headaches when they're reading. They fall asleep when they're reading. Or upset
Double
tummies,
vision when
double
driving,
vision when
or-
driving. Certainly, all those things. Even if patterns drive you nuts,
Okay.
like patterned carpets or stripes on wallpaper.
Okay.
Sometimes that's a visual symptom of,
okay.
of a visual thing. Sometimes people have problems with that too. And from a student standpoint, kids that don't want to sit and read. Now, there's a lot of
Okay.
reasons why you might not want to read, because the video game's more interesting. But certainly, any child that's having trouble in school
okay.
ought to be seen. And maybe it's a vision problem, maybe it isn't, but you don't know till you've checked.
Okay.
And you get seen checklists for, is it an attention problem? Is it a sensory integration problem? Is it a vision problem? A lot of the same behaviors show up on these checklists. So you kind of need to check. And I've had people come in with, and I can check out the vision, I can see some things, but I don't think it's everything. Have you ever had a, sensory integration
Okay.
evaluation? Maybe that's, maybe the nudginess in the chair that you were talking
Yeah.
about, maybe that has to do with the child doesn't know where his body is.
Okay.
And there's somebody else you need to think. But yeah, any of the kids that have learning problems, you want to make sure that the eyes are
Talking
and
to the
vision
brain.
are talking to the brain,
Okay.
that they're working together so that they can support the learning that has to come.
Okay. And we are out of
That's it.
time. So I think we're going to have a sequel, because this is just like really fascinating to me. So thank you very much.
You're most welcome.
For coming in and bringing your visual aids,
Yes.
no pun intended. This has been really interesting. And I want to thank everyone at home for tuning in. And hopefully you found tonight's conversation as interesting and piquing your curiosity as much as I have. So thank you very much. I hope you have a wonderful day, wonderful evening, and I will see you around town. Good night.